Well, thank you for coming back. It's Sunday the 5th of April. Now, the official global cases are about 1.2 million now, but we know this is an underestimate. And deaths officially at 66,000, but again, we know that's an underestimate. Now, a few brief things that the World Health Organization have been saying lately. And then we'll move on to look at a few countries today. Now, the World Health Organization are reiterating find, test, isolate, treat every case and trace every contact. Clearly, we're not doing this because we haven't got the testing, so I don't know quite why they're saying that again. But this is the way out of the lockdown. This is our exit strategy. We have to do this, but we need massively more testing. And then they were talking quite a lot about funding. So they're talking about case finding, testing, contact tracing, collecting data, communication and information campaigns all need to be funded, which is true. And in some parts of the world, it's very unlikely they will be. They talked about funding health and care provisions and supplies. Again, clearly that needs funded. They're stating the obvious. All countries to remove financial barriers to care. Great sounding words, and of course I agree with it completely. But the health inequality between countries and within countries is so pronounced and entrenched. And there's so much corruption in many places that we know that's not going to happen. Although it is a laudable aim, I agree with that. Everyone should have free health care at the point of need. But practically, I don't really see where we move forward on that. Then a couple of things from the World Health Organization that were concerning. This pandemic is inhibiting door-to-door polio immunization. Polio, of course, is a wretched, paralysing disease of the nervous system, and we can vaccinate against it. And in many areas, it's been virtually eliminated, and it's just need that final push to eliminate it from the world. And the other thing, and that push is delayed now, so that's quite distressing, really. Increased risk of domestic violence. So, people in lockdown situations, difficult situations. So this just shows the importance of really trying to help each other, communicating with people. So if there's someone that you do know might be in a vulnerable situation, just please make that extra effort to communicate with them. And I thought about leaving this out, but I watched an interview with Dr. Ryan, Executive Director at WHO. And after listening to him for about 20 minutes, I thought, well, what has he said? Maybe I'm just not listening very well, but because I like to get bullet points. What is this actually saying? Get rid of the waffle. And he was saying there's no accurate predictions of what might happen. Well, fine. He said there's 30 vaccines under development. Well, we know that. Now, this is encouraging. I'm not being cynical about this. 30 vaccines under development. They're not all going to work. They're going to work in different ways, and hopefully we'll end up with several effective vaccines. But he did say it's not going to be this year, it's going to be next year, 2021, which again we already knew. And he said there's trials on chloroquine and hydroxychloroquine that are awaiting results. So he's saying there's no definitive treatment yet. But I did notice that President Trump has asked President Modi in India Modi, not sure, Modi, I think, to export more chloroquine and hydroxychloroquine to the United States. Now, this is a simple generic drug, and it's just a bit humbling to notice that the United States is dependent on Indian exports rather than having their own capacity. So, another reflection on the globalization that's been highlighted by this pandemic. And then Dr. Ryan talked about at-risk populations, which is fair enough, refugee situations and poor situations in Africa. And we've highlighted those several times. So nothing too impressive there, to be quite honest, from the World Health Organization. And the other thing that's been striking me recently is the World Health Organization have talked a lot about China and the successes in China. Now, we know there's been successes in China after a disastrous start. But surprisingly enough, you hear very little about Taiwan. I wonder why that is. Now, Taiwan is a large island, large population, very few cases, very few deaths. And I trust these figures because Taiwan is a fairly open, well, it is an open society. And they instigated measures before Chinese New Year, which remember was the 25th of January. So while the World Health Organization was saying, well, carry on flying in and out of China, it's fine, Taiwan was not saying that. Taiwan was being proactive. They reacted fast, took the risk seriously, and to be fair, they had SARS experience, severe acute respiratory syndrome, 2002, 2003. So they had learned from that. So the National Health Command sprung into action. This is in mid-January. They banned travel from China. They stopped cruise ships from docking. You know, this is in mid-January, and yet we've just seen cruise ships landing in California. There's a couple in Fort Lauderdale yesterday, and another one in not California, Florida. Sorry, Florida. A couple in Fort Lauderdale, one in Miami. Still disembarking passengers, meaning people went on cruises relatively recently as late March. And yet the proactivity in Taiwan here was quite exceptional, as is borne out by the results. Punishments for breaking home quarantine. So people that had been in contact with cases were quarantined, and they didn't breach that because they knew there was consequences. Mask wearing and massive production. Now, the idea here is that infected people will protect others from their infection by wearing masks in public. They did lots of testing, and they've got good healthcare facilities. So massive success story there in Taiwan. It's a pity that it's not flouted more as a success story that it is. And of course, I think we all know why it's not. Now, the United States, getting on for 1/3 of a million confirmed cases, partly due to increased numbers, partly due to increased testing. Great increase in deaths. The president has said there's going to be a lot of deaths in the next 2 weeks, and this is not avoidable, I am afraid. New York, lots of cases in New York State. I think that's now out of date. The New York City deaths are already over 3,500 just in New York City. So a huge epicenter there in New York. But the concerning thing is the curve in other parts of the United States is on a similar trajectory to what New York was on a couple of weeks ago. Ventilators have arrived from China. I hope that involves CPAP machines as well, continuous positive airway pressure machines, which are much easier to use than ventilators. New York City needs another 45,000 medical workers. Let's hope they get them. It's a big ask. 45,000 volunteers from presumably other parts of the state, because overseas nurses and doctors, I would imagine, are not registered to work in New York City. So it seemed like what they're talking about is having a big movement of medical workers, nurses, doctors, the whole works, into New York. And then once New York has passed the peak, these people would move on to somewhere else. But the practical implications of that are very hard to meet. Now, Governor Cuomo's saying he's nearing the apex in about a week. Now, let's hope there is an apex. So what the governor is hoping for is that the cases are going up. We're about there now. They're going to go up a bit more, then he hopes they're going to peak. And I really hope he's right. Let's hope it's a peak like that. What I fear is, I think he might be right. I think the cases could be peaking in the next week or two. But I'm just hoping it's not going to be a prolonged plateau before there's a drop-off. So he's being optimistic. Let's hope he's correct. Military involvement. The president's mobilised military and support roles. 155 sailors now tested positive on the Franklin Roosevelt, the aircraft carrier. Now, I don't know how many have been tested, but if 155 are positive, I think we can assume there's been more than that. So it looks like there's a bit of an outbreak there. And this has always been a concern. Ships, prisons, care homes, where people are confined together, is a major concern. So I don't know what's happening about that. Let's hope someone is being proactive. I think they might be getting moved into isolation facilities on Guam, but I'm not sure about that. Now, I'm not criticising the United States. I get told off for criticising the United States. I'm not doing that. But it seems fairly self-evident that part of the problem is that the response is disparate, with different states responding in different ways. So it's a point of fact now that some states in the United States aren't instigating lockdown measures. That the response is varying from state to state. And even perhaps more concerning, or as concerning, competition between states for resources, which is not a good thing. Cases increasing: New Jersey, Louisiana, Michigan. So it looks like the curve in these places is following a similar trajectory to the curve in New York, just being a bit behind. The appalling lack of proactivity in allowing Mardi Gras to go ahead beggars belief. And I notice there's a bit of a blame game being played there about that now. But the Taiwanese anticipated this a couple of months ago. I was talking about this in early February, and yet Mardi Gras went ahead. Yeah. New Orleans, the death rates are high. Quite a lot of comorbidities in New Orleans as well. It's not the healthiest place in the world at the best of times, so quite concerning. Now, in contrast, the California lockdown does seem to be working, with less cases and deaths in California. So the fairly early reaction of California is promising. So that's interesting. Florida, there's been a few cruise ships disembarking. There was a couple in Fort Lauderdale in the past few days, and another one in Miami today. People disembarking, but sick people there are going to put more strain on the Florida healthcare system. Again, the idea that people will be getting on cruise ships a couple of weeks ago is difficult to explain. We knew we had a pandemic a couple of weeks ago, and people thought, oh no, I've got a pandemic, I'll just go for a cruise. And that was allowed to happen. The lack of proactivity, as we've talked about repeatedly. Now, in my country, we've done under 200,000 tests, but we've got nearly 500,000 positive cases. So what this means is, to me, the number of cases in the UK is way, way, way higher than this. And I've been doing a bit of an informal survey locally, and it seems that in the last week of March, deaths locally are about 30% higher than normal. And anecdotal evidence suggests that has increased in the past week, in the beginning of April. Now, if that's the case, and this is due to COVID, as I believe it is, that means these people became symptomatic on the mid-early March. And that means that we had quite a lot of community spread in my country late February. And it also means that deaths, I'm afraid, are greatly underreported. So if we've got about 30% more deaths in the past few weeks, as appears to be the case locally to me in the north of England, it appears to be the case. I can't give you a chapter and verse on it, but it does appear to be the case. Then that means there's a lot of people dying at home, probably often with other conditions that have been so exacerbated by the COVID-19 that it's resulted in death. So that means that this, unfortunately, is a significant underestimate. And if that's true in my country, it could well be the same in other places. Awful. A 5-year-old child died in the UK. Now, they did have comorbidities, but still appalling. But parents can be assured that children have a much, much lower risk than adults of symptomatic disease and severe disease, and way less than older adults. So this 5-year-old did have comorbidities. We don't know what they were, but still absolutely appalling that the COVID-19 should cause the death in a 5-year-old. Now, my government's launched something called the status checker. Now, what this is, it's a government website, and you log into it when you're symptomatic, and you give your symptoms. and where you are, and that data can then be used to try and predict and map the course of the epidemic, or the pandemic as it is becoming an epidemic locally. So that seems a good idea. It was voluntary, but a status checker. So I'd like anyone really watching in the UK who is symptomatic to log on to that and to enter that data. That can really help in government planning. Now, the lockdown here started on the 23rd of March. We're 12 days in. Increase in new cases should slow in 7 to 10 days' time. And then there'll be a plateau. This is what modelers are currently thinking. So I must say the lag time, I was hoping for reduction in new cases much sooner than this. So really we're talking about 20 days of lockdown before we're seeing a lot of benefit. So it's disappointingly slow, but everyone believes it is working. Now, this has been really annoying. People sunbathing outside. Now, if you can sunbathe on your balcony or in your garden, that's fine. But not in public places. We're only allowed out for exercise. Now, looks like this could... Most people, as I said this morning, most people are obeying the rules. But the minority that aren't, it's always the same. If there's a minority don't break the rules, if the minority do break the rules, everyone has to suffer. And it may be that the rules are tightened and we're not allowed to go out for exercise anymore because people are abusing the system. And I've had a few emails of people, and people across the road from them were having parties and things like that with 20 people coming around. This is the sort of thing that could ruin it for everyone and, of course, kill many, many people. We must obey the rules, and they are rules. I got an email this morning saying these recommendations are from the government, aren't recommendations. They're not the recommendations, not rules. No, they're rules. We have to obey these. Otherwise, it's going to be tightened up and everyone's going to suffer and there's going to be more deaths. Now, this was interesting. Matt Hancock is my Secretary of Health, who is well informed. And he's had COVID-19. And he said that the rules on movement still have to apply to him because he's not sure how immune he is. Now, I was remarkably disappointed to hear him say that, because other studies have shown that when someone has the antigen, that is the virus, it acts as an antibody generating molecule, and we generate antibodies, which are our immune proteins. That should make us immune to the disease. So I don't know if he's just being very conservative, but on previous videos I've said that people with the antibodies are going to be able to go back into circulation in society. And he's saying, well, no, the evidence for that is not yet there. We're waiting for more science. And I assume he's informed by the best scientists we have. So that was really potentially quite disappointing. I think he's just being conservative. And I still expect people who've had the virus to be immune. That's still my expectation and certainly my hope. Let's hope Matt is just being a cautious man. Now, Scottish disappointments. I'm not going to dwell on this, but it just beggars credulity. The Scottish senior medical officer in my country, and this is just a national disgrace, went to a second home 2 weekends on the trot, having told everyone to remain in their primary residence. It just beggars credulity and is quite frankly, in my view, a national disgrace. And I heard the Scottish Minister of Health just before there was the first cases in Scotland saying, well, of course, we've no cases in Scotland yet. The complete lack of proactivity. And then this flaunting of the rules by the very people that are making the rules. No more to be said about that. But let me appeal to you directly, from one ordinary bloke to another ordinary bloke or another ordinary woman in the street. Please obey the rules. Some people are going to break them. Some people are going to go to parties. Some people are going to go to sunbathe in the park. Some people are going to go to their second home for the weekend. Right? Not me, not you. Keep it that way, please. Now, Italy. Great number of cases. Again, we know it's way higher than that. Month into the lockdown, now been extended to the 13th of April. Real difficulties in Italy as a result of this lockdown, especially in the poorer south of the country. Major difficulties. But the rate of deaths is decreasing. We are seeing signs that it's working. So if deaths are decreasing now, that means new cases decreased a couple of weeks ago. That means infections decreased a week or two before that because of this lag. So the reduction in deaths means there's already been a reduction in new cases, means there's already been a reduction in new infections. So this is very encouraging. It's the lowest deaths for a week. And let's hope this trend continues, and I expect it to, giving the people of Italy some reward for the great difficulties that they are currently under. ITU patients numbers are reducing as well. New cases numbers stabilising, and I've said that twice. So some good news there from Italy, but it is coming at a huge cost, financially, socially, in every way, but it is working. Now what we need to do to go forward is get the testing done, get the isolation done, make this whole thing a much more specific, targeted approach. That's our exit strategy. So Italy looking like we're getting near the peak or past the peak. Spain likewise. Less deaths overnight in Spain. Now I know appalling number of cases. We know it's way higher than that. More deaths. That was the day before yesterday. That was yesterday's death. So the death rate is declining. 809 a couple of days ago, 674 for the last 24 hours to overnight. So this is an appalling number, but the trend is going down. And the lockdown's been extended to the 26th of April. Or the government are currently debating that. It looks like it's going to be extended till then. So the people of Spain and Italy can know that the sacrifice they are making is starting to work. France, we're not there yet, unfortunately. Cases still greatly increasing in France. Critical patients being airlifted to other parts of the country for care. Now, Africa, quite a few problems in Africa. We did look at quite a few countries of this yesterday. South Africa, the cases and the deaths don't mean too much. They're higher than that. But so many people in South Africa, as in other parts of Africa, are living hand to mouth. The money they earn that day feeds the family that night. So the lockdown is not working. And the police are responding with force. So both of these are remarkably unfortunate. Firstly, that the lockdown's not working because people don't have food or basic provisions, and the police are using force, which is also distressing. So when I say physical distance is not always working, that's English understatement. People are out and about trying to make money. And unfortunately, this is going to be a bit of a preview of other African countries where I still fear there's going to be a lot of spread. And the other thing, a lot of African countries, HIV, about 25% of the adult population in South Africa's got HIV. Now, a lot of it are controlled with antiretroviral drugs, but we still don't know how badly people with HIV are going to succumb to the COVID-19. Now, China has been sending supplies to Serbia, and the Serbian Prime Minister said the support of China saves lives in Serbia, which is good. Hungary, the flight from China was met by the Prime Minister, 60 tons of supplies more on the way. Czech, Slovakia, Austria, Czech Republic, Slovakia, Austria, Greece, Spain, Canada and the US have all received relief supplies in relatively large amounts from China. The supplies are good. The supplies are useful. And I'll leave you to make any conclusions you want about what's going on there. But the supplies are useful, the supplies are welcome, and the supplies are saving lives. So that's good. Now, just to finish today, Iran. We know things aren't good in Iran. We don't know how bad they are. We know they're worse than this. But they're talking about resuming low-risk activities, which is really quite frightening. So where are we up to today? What are we thinking about? Well, we can see lockdown measures having effect in Italy and Spain and peaks being reached. We see that places like France, the United Kingdom, the United States, we're still firmly on the way up. And in all these countries, France, the UK and the United States, there's going to be more cases and many, many more deaths in the next few weeks. And many more hospital admissions. The next few weeks is going to be a difficult few weeks. There is no question about that. I think the lockdown measures will work in France and the UK. I'm more pessimistic about the United States because the response is rather disparate in the United States. But of course, we're still hoping for the best. I'm terrified about what's going to happen in poorer countries. India, Pakistan, Bangladesh, Southeast Asia, Philippines, many African countries where the epidemic is still in a relatively early stage. Our exit strategy from lockdown is massive testing and more precise targeting of cases, isolation, contacts, quarantining and treatment. That is our exit strategy from the lockdown. The overall exit strategy from the pandemic as a whole, basically we're going to have a problem, I believe, until vaccines become available. So there is difficult times ahead. We will work through it, but unfortunately in many countries deaths are going to occur in the next few weeks, and in many poorer countries I fear there's going to be many more deaths over the next months.